All right, good afternoon. Thank you for joining us today for our Hard Histories conversation. My name is Mallory Pilat. I'm a doctoral candidate in the history department at Johns Hopkins, and my work focuses on the history of African-American women in the 19th and 20th century, in particular on their ideas and interactions with France. I am thrilled to be here today to host this conversation. Launched in fall of 2020, the Hard Histories at Hopkins Project examines the role that racism and discrimination have played at Johns Hopkins. Blending research, teaching, public engagement, and the creative arts, Hard Histories aims to engage our broadest communities at Johns Hopkins and in Baltimore in a frank and informed exploration of the myths that have become part of our university story, and to offer evidence of how race and racism have shaped Johns Hopkins. In spring 2023, we are hosting a series of conversations exploring the histories of Blackness, slavery, and racism in the Maryland area and beyond. Today, we are excited to host a discussion about the possibilities and challenges of researching hard histories in medical archives. We invite our panelists now to turn their cameras on. We are honored to have with us today three great panelists in discussion with Hard Histories Project Director Jones, Dr. Martha Jones. First off, Dr. Heather L. Cooper is Project Archivist for the Reexamining Hopkins History Initiative at the Chesney Archives, where her work focuses on processing and increasing access to collections that shed light on histories of race and racism at Johns Hopkins Medicine, nursing, and public health. She has a PhD in history, African American history, and an MA in library and information science from the University of Iowa. A scholar of race, gender, and US slavery, she began her archives work at the Iowa Women's Archives, where her processing, instruction, and outreach focused on engaging with diverse collections and centering the experiences and records of underrepresented communities. She is also a co-organizer of the Iowa Colored Conventions Project, a state satellite of the National CCP, dedicated to uncovering the little-known history of African-American community building and political organizing in 19th century Iowa. Kamal Kaur is an undergraduate student studying molecular and cellular biology and public health studies at Johns Hopkins University. She is currently a student in Dr. Martha Jones's Hard Histories Hopkins Spring 2023 Research Lab. As a Baltimore local, she's taken an interest in discovering the important connections between the historic city and the Johns Hopkins community. Dr. Ayah Nuriddin, Doctoral Fellow in the Society of Fellows and lecturer in the Council of the Humanities and African American Studies at Princeton University. She received her PhD in the history of medicine at Johns Hopkins University in 2021. Her dissertation, entitled Liberation, Eugenics, African Americans, and the Science of Black Freedom Struggles, 1890-1970, analyzed African American engagement with eugenics, hereditary thought, and racial science as part of a broader strategy of racial improvement and Black liberation. She holds a master's in history and a master's of library science, MLS, from the University of Maryland, College Park. She was a graduate fellow in the Center for Medical Humanities and Social Medicine in 2017 and 2018, and a dissertation fellow at the Consortium for the History of Science, Technology, and Medicine, CSTM, in 2018 and 2019. Her work has been published in the Historical Studies of Natural Science, the Journal for the History of Medicine and Allied Sciences, The Lancet, Nursing Clio, and Somatosphere, and she has appeared on American History TV on C-SPAN. And finally, Dr. Martha Jones is the Society of Black Alumni Presidential Professor, a professor of history, and a professor at the SNF Agora Institute at Johns Hopkins University. She is a legal and cultural historian whose work examines how Black Americans have shaped the history of American democracy. Jones is the author of Vanguard, How Black Women Broke Barriers, Won the Vote, and Insisted on Equality for All, published in 2020, selected as one of Times' 100 must-read books for 2020. Dr. Jones and our panelists will be in conversation for about 5 minutes, and then we will turn to your questions. Please submit your questions at any time using the Q&A function. And finally, if captioning is available to our audience members with Zoom, we are also posting a link in the chat to the live transcript URL for those who prefer to access captions that way. So thank you all for being here. I will turn the conversation now over to Dr. Jones, and I will see you all at the end of the discussion.
Thanks so much, Mallory. It's great to have you back with us at Hard Histories. Rumor is we're going to see more of you in the coming year, so we're really excited about that. But thanks for joining us and convening us this afternoon. And thanks to this panel. I wanted to say, just by way of introduction, that and we'll hear much more about this from Dr. Cooper and from Kamal. But we have been at work in collaboration with the Chesney Archives this semester, looking at the materials related to what was the third prong, if you will, of Mr. Hopkins's original bequest, what we refer to as the Johns Hopkins Hospital Colored Orphans Asylum. And while there's a lot more to say about what we've been discovering, and I hope folks will follow us on our Substack and more to learn about all our findings, today we wanted to really focus on what has been new for us in the lab, which is the challenges and the ethical dimensions of working in the medical archive. We've worked in many sorts of repositories, from our own special collections to the Maryland State Archives in Annapolis and more. But this has been a unique semester for us, and one that we are really still thinking through in real time. So we're so grateful to this panel for rolling up their sleeves and helping us think through these questions, and for you all for being here and for sharing your questions and your thoughts as we go forward. But I wanted to give each of these panelists a chance to introduce themselves a bit. We're in a sense knit together, the four of us, by the stories and the people that we encounter in the medical archive. But I want to first ask you just a bit about your own journeys to this place, because even in the bios, I think we could hear that there are paths expected and I think unexpected. And so maybe, Dr. Cooper, I could start with you and just ask you to tell us a bit about how we find you here. And we're so grateful that we've been able to work with you. So welcome.
Thank you. Yeah, I mean, my background is both as a trained historian and college instructor, and more recently an archivist. And throughout all of those arenas, my professional life has really focused on bringing the stories and experiences of typically underrepresented communities to light, whether that's been in the classroom, in my own research, or in the archival reading room. So my move from history, from academic history to the archives, was partly a desire to connect more with members of the public and the community in order to bring these sources and stories to the surface, and different kinds of opportunities in that context to do that work. Here at Johns Hopkins, where I've only been for, since last summer, the work has focused on addressing past inequities and telling a more inclusive story about the institution's history and its relationship to Baltimore. So that's taken a couple of different forms. One, trying to highlight better the contributions of people of color to Johns Hopkins as students, as professionals, as doctors and administrators, but also trying to better understand and acknowledge the structural racism in which those people were operating, and the experience of people from the community who were interacting with Hopkins as patients, research subjects, and residents of the city. And so, I think from my perspective, we have to confront those aspects of our history in order to address and overcome racial inequality today. And so that's really been a big part of my perspective here at the Chesney Medical Archives.
Yeah. Thanks so much. Dr. Nuriddin, can I ask you just to tell us a little bit about your journey?
It's been a long and winding journey is what it feels like. I think for me, my initial interest in even getting into medical history and particularly racism in medicine sort of started very early for me. And it started in a library. I used to work at the bioethics research library at Georgetown University, where my mother is on the staff, and I was supposed to be shelving the books, and I started reading them. And then sort of literally the rest is history. So I'm trained as both a historian and as a librarian. And I'm really interested in and very committed to sort of exploring and amplifying the voices and experiences of Black folks, as well as thinking about how to sort of fully but ethically document the ways that scientific racism and medical violence are sort of enacted against Black folks, and sort of wrestling with all of the ethical questions therein. I'm trained particularly in the history of eugenics, which of course is a very fraught one that has some very robust links to the history of Johns Hopkins University. And I only got to sort of scratch the surface of that as a graduate student. So I'm excited to be here today to sort of, dig a little deeper into things that I didn't get a chance to do as a graduate student.
Oh, great. Well, it's thrilling to have you back. So thank you so much. Now, Kamal, I think, one of the questions I often get is, who are the students in your lab? How did they get to you? Why are students coming and spending a semester in a learning experience that some people would think was kind of unorthodox, right? We've been spending weeks, for example, in those raw materials that Heather Cooper has processed at the Chesney, piecing together lives. And I know you'll talk more about that a little bit later, but maybe from your bio, no one would anticipate that you would wind up in our lab. So tell us a little bit about that.
Yeah, so as a biology pre-med student, you wouldn't typically expect to see most of us in a history research lab, but I'm very grateful to be part of the Hard Histories Hopkins project, mainly because I've grown up in Baltimore for almost 15 years now. I immigrated from India when I was 5, and I've been here ever since. And so I believe I've been exposed to a lot of my own city's medical history when it comes to confronting racial disparities in healthcare, and just over the discrimination that is faced by African-American individuals on a daily basis. And now coming to Johns Hopkins, I've always had this curiosity to learn more about, I guess, the Institute, because it hasn't had the best reputation with the city, but I'm just curious to know more and kind of discover that connection to the Baltimore community and figure out ways that we can kind of like rebuild what we've already established. And I stumbled upon the Hard Histories project, as any student does when registering for classes, but this preconceived notion of wanting to learn more has been a huge factor of wanting to be part of this project, uncover details that I don't think a normal student at Hopkins would be able to uncover, and kind of just be part of a movement to really display what history at Hopkins is and kind of make that very apparent and transparent to the community that we live in. So, yes.
Well, it's been great to have you on board, and I've shared with you, I started as a biopsychology researcher, and that wasn't my destiny as a parent, but it taught me something about my capacities as a researcher too, right? That I could bring those kind of skills and dedication and all those things, and you've really brought your experience to us. So we're so happy to have you with us, Kamal. I want to dive in because, as you all know, we have really encountered some important questions in now working with the materials from the Orphans Asylum. We've learned a lot about the kind of heightened scrutiny that records related to that are typically found in a medical archive are subject to. We've learned a great deal about confidentiality, about privacy, about federal law and more, that really is active and shaping what happens at a place like the Chesney. But I want to move away from law, not because I'm not interested in that, I'll know I am, but because I really want to think about from a historian's perspective some of the ethical concerns that we have. And if I could start with you, Dr. Nuriddin, I know that your work examines how African Americans have navigated questions of racial science, eugenics, and more in relation to struggles for racial justice. I wonder, in your work, how you approach the materials in medical archives and how that encounter differs from, say, the kinds of published materials that certainly you also work with. I think it's a really powerful illustration of the contrast.
So yeah, the contrast in many ways, both in the sort of process of accessing material, but also in the ways that I write about some of that material is fundamentally different when using medical records. I haven't actually been in the records of the Colored Orphan Asylum yet, but now I think after this conversation that has to get added to my very long to-do list. The bulk of my experience specifically using medical records and sort of all of the complications that go along with that has been using the records of the Crownsville State Hospital that are housed at the Maryland State Archives. What started initially as a second-year paper, it became, I published as an article in the Journal for the History of Medicine and Allied Sciences, and using those records was such an education. First, the process to access them, going through the IRB for the Institutional Review Board for the Department of Health and Mental Hygiene for the state of Maryland, and sort of having to navigate questions as a historian that the IRBs are not really set up for sort of wrestling with historical research. They're usually much more framed around social scientific research or biomedical research, and sort of promising them very earnestly that nothing nefarious was going to happen if they let me into the records. But one of the things that was such an education was that the ways that medical records are kind of the raw material, the sort of undigested parts of medical history that you don't really get in, for example, a published article in a medical journal. And so being able to see, handwritten notes from physicians, to be able to see the actual intelligence tests and other sort of inventories from psychiatric patients where there's handwritten notes marking them up of how badly someone might score, and that's why they ended up admitted into the institution, is they document not only the sort of ways that diagnostic and therapeutic practices work, but also all of the really, it's hard to describe this as other than violence, right? That is enacted in these institutions, especially a segregated institution like Crownsville that had been historically overcrowded and under-resourced for much of its history, despite the activism of its Black staff and sort of surrounding communities. But I think the things that you see in those records really sort of change how you view what the history of medicine is doing and what it should be doing, right? Coming across these raw materials, actually seeing, autopsy records. There's one that I remember shook me. It was the autopsy of a child, and included in the file basically is a photograph from before the child's passing, where you actually see the hand of an adult holding the child's face still for a photograph. And I'm like, that image, has really haunted me for a long time. And what I hope to do in the work as I continue to sort of think about institutions like Crownsville and sort of in other areas of my work is, how do I do the work in a way that brings justice to this child, right? How am I now accountable to this child because I've now sort of seen the violence that they were subjected to? And that is a thing that I have wrestled with, and I don't always have, I think, the best answers for, but it really, it makes us think very differently about what the work of the historian and what the work of the archivist can be and should be.
Thank you. We will, I know, welcome you or encourage your interest in the Colored Orphans Asylum materials, in part because I can say there we have encountered notations about girls who are said to be feeble-minded and otherwise mentally defective, and there is a longer story about, I think, the fate of those particular girls as they are deemed ill-suited for this particular institution and wind up in other places in Maryland and elsewhere. And part of Kamal's work has been to trace some of those stories. So we'd very much welcome your expertise. I know we all would. Kamal, we've already suggested how new this material is to you, but you have already had a hands-on experience, on the one hand, with the records from the asylum itself, and on the other hand, newspaper reports and census materials. Is your thinking, are you able to distinguish between those materials yet, and how we handle them? I know our thinking is still in progress, but I'd love for you to sort of help us think comparatively about how to handle those materials.
Yeah, so just to reiterate, I haven't fully scratched the surface, and like my journey in these archives has only yet begun. And thank you to Dr. Jones and Dr. Cooper for helping me work throughout all of it. From what I've gathered so far in my research is that when comparing newspapers, census returns, and just the asylum records themselves, they're very similar in terms of deciphering the information that is being told. I don't believe I had any difficulty in figuring out what the document was telling us, but the main thing that stood out was how this information would be utilized and analyzed to help with my research, and how I can take this information and have it play a larger role. So with the census records, they acted as the starting point of my research, and they kind of laid the foundation or blueprint, as I like to say, to help uncover and learn the identities of these girls that were part of this asylum, more specifically like what expenses they had, and even their journeys after the closure of the institution. And all this specific information and very personal details, I believe wouldn't be easily obtained through newspapers, but they acted as that foundation that helped me transition to find more information. As for the census records, they were very helpful in coincidence with the records themselves when trying to uncover personal and basic facts. So after I have laid down this groundwork and I now know where I'm headed with this, that's where the newspapers came in. So I like to say that they served as the middleman of the research. And I say this because now that once the groundwork has been laid, I have the basic information needed that I can use to find specific details surrounding a specific time and location. And in my case, it was Baltimore in the earlier 1900s and also the later 1800s. And just working with these newspapers allowed me to build some connections and start branching upon some of the narratives that I'm working with, specifically with the Baltimore Sun and the Baltimore Afro-American newspaper. I was able to uncover information, some very gruesome and unfortunate, but they helped me make connections throughout the years and just fuel my research forward when I'm trying to build these narratives and kind of build connections between generations of the girls. So
yeah.
yes.
I love that, because none of the records really stand alone, do they? That you're doing that work of assembling and piecing stories together, and some of them very powerful stories. I agree, very moving and very powerful. So Dr. Cooper, I wanted to ask you about the transition from the Iowa Women's Archives to the Chesney, and in particular to the orphan asylum materials. Your finding aid has been indispensable to us. And so I think there's no question, but you are the person who, to this point, has gone through these materials more carefully than anyone. And we've really benefited from that. But I did want to ask you just to think out loud with us about the contrast between working in the medical archives and with these materials as contrasted with other experiences of yours.
Absolutely. They're very different institutions. The Iowa Women's Archive is a small archive that was founded in the 1990s and started collecting from scratch with a very close relationship to the community and a lot of dedicated efforts specifically to bring in records of underrepresented groups in the archives. the Chesney is an institutional repository. We are the home for Johns Hopkins medicine, nursing, and public health records. And that also means that, you know, we're connected to an institutional history that Johns Hopkins writ large is very invested in. So going back into those materials and trying to better understand the relationship between structures of racism and discrimination and belief systems and the way that the hospital and its physicians were operating is obviously a challenge to the traditional narrative that's been told. And I think it's important that Hopkins has committed to starting to do this work and reflect more critically. I think, you know, there's a number of things as we think about privacy and access that are important differences between the Iowa Women's Archives and Johns Hopkins. Because a lot of the IWA records, you know, are personal papers that were voluntarily donated by people who decided they wanted to be part of the historical record and have their material preserved in that way. It's very different when you think about records that contain patient records, people who did not necessarily consent to have those aspects of their lives become part of the archive or part of a historical narrative. And so I think, you know, that's something that we have to think about. There's also a difference in terms of access for researchers. So we at the Chesney Archives are open to the public. Anyone can come in and do research, but at the same time, because of our connection to Johns Hopkins Hospital, we're a HIPAA covered entity, and that means that certain kinds of information have to be protected. So in order to see materials, we have to make sure that that protected information isn't in those records, either by screening or by having people go through the process of applying to the Privacy Board or the IRB. And while that's fine and good and important, I do think that it creates a greater barrier for your average community member who might want to come in and learn something about these institutions, because that is a process that you have to go through. And that's a barrier between the community and Hopkins that I'd like to see us start to chip away at and make these materials more accessible. And to that end, part of the work that I'm doing in terms of reprocessing and describing, and also creating guides that let people know about records that are useful for particular topics related to race and racism, is before people can come in and do the work, they need to know that we have the material, right? So part of our work is just trying to create better description that allows this material to be discoverable, that lets people know that Chesney is a place where they can come explore these topics, and really helps them to some degree in starting to define their research and navigate those channels for getting full access to material.
Yeah, I think it's right there where we have, it turns out, really needed to dwell and think carefully. The recognition that in the materials that Kamal is assembling are the lives of community members, are the lives of descendants, or I should say forebears of community members living among us today. And this has led to, I think, an important introspection, even absent the legal restrictions. What are the ethical questions? And it has become especially acute as we have created a database of, I think, Kamal, we're at over 400, approaching 400 entries in a database that include names and episodes, incidents, moments in lives that we are beginning to assemble. And still, as we began to read into the secondary literature and the histories of orphan asylums in this period, we saw that historians were making very different choices when it came to using names. Some studies are subject to restrictions. And so authors are forbidden, right, prohibited from using names. Others choose to use pseudonyms or to create composite portraits rather than identify individuals. And still we've met others who say to us, no, I have deliberately made these names more accessible, more visible in the hopes that descendants might discover someone in these materials and be able to recover that part of a family story. So there isn't one answer here, but it is all the more reason why we have, I think, slowed down and wanted to think about this. So Kamal, if I could start with you on this point, it's been exciting, it's been moving, it has not always been easy as you have begun to recover the stories of girls in the orphan asylum. And you yourself have asked us in the lab about the ethics of publishing names. I know your reflections are still in process, but tell us a little bit about how your thinking has developed as you've been now doing the work. No longer, if I could put it this way, no longer an academic question, right? But a very feeling our own power in the most complicated sense as researchers over this material, and now reflecting on how we handle it in a way that is purposeful, that is intentional, that is ethical. So that's a big question, and everybody's going to speak to it, but I want to start with you because you've been on the front lines of the work.
Yes, so uncovering names and just discovering this entire history hasn't been easy, and more so like an ambivalent experience. As a new researcher, you think, oh, I found something great, I found some new material, oh, this is amazing. But then when you scale it back down to being a human, what you're actually unpacking are the identities and the lives of real people and some of the most gruesome experiences they've lived through. I know that with us at Hard Histories at Hopkins, it's always been more than just a name. We've been more invested in the stories and the stories that deserve to be told, not only to people like us in working in such a field, but to the public for the sake of learning more about where we live and the history behind it. And I know that an important aspect of my part on the project is being able to build these narratives of these girls and like open doors to potential family connections. But with that comes the main question: is it my story to tell? Are these names and identities ones that I should be revealing? And if there are any family members that the girls have out there, would they want this information of their ancestors to be publicized on a larger scale? Now, it's been a tough journey of going back and forth with these questions with no real answers. And although, correct me if I'm wrong, working with the Chesney Archives, we were told that the specific information that we were working with in regards to the asylum is not confidential and can be shared. But now my main takeaway from that is, although it may be legally acceptable, that doesn't mean that it's acceptable ethically or morally. And like, how are we able to tell this important history in a way that humanizes these girls and doesn't limit them to just being a statistic of the asylum? And throughout this entire journey, like you mentioned, we've gained multiple perspectives of different historians and different researchers. And I've yet to still struggle where I would want to go with this. Part of me still believes that if we are able to emphasize how stories like these have been long forgotten and neglected, but would finally allow families to learn more about their generational history. And I feel that with so much time passed, it's very important to give others the opportunities to uncover their own history, especially pieces that have been lost for a really long time. But yes, once again, these ethical questions are one that I am yet still working through. And I hope that with this conversation that we're having today, I can kind of figure out the pieces myself and figure out how I want to display some of the information we're uncovering. So,
yeah. I'm going to invite Dr. Nuriddin in part. And I think I'm remembering, Dr. Nuriddin, we spent a semester together very early on in my time here at Hopkins, among other things, reading with Black feminist thinkers about many things, including what we often term the ethics of care. And I wondered if you could say, from your point of view, what we mean by the ethics of care and how that might be a framework through which researchers like Kamal and others in our lab might approach this very, I think, thorny question about how to use names.
The sort of Black feminist ethics of care, something that are also very important to how I envision the work that I do and how I envision the best ways to write about the people I come across in the archive. For me, a lot of that is about a sort of a recognition of and a commitment to the humanity and dignity of the people that I write about. Being invested in the significance of their stories, and as well as sort of imagining a kind of accountability to them, right? As the person who may be part of the sort of uncovering of their stories, right? That it is important for me as the historian to think about what and maybe how this person might have understood their own conditions, how they may have wanted to portray themselves to the world versus how I, as a historian, see or deem that they should be portrayed. And it's sort of part of this kind of like full but ethical documentation of racism and violence, right? That how do I show what has happened at these institutions? How do I uncover this history and make it available while ensuring that I don't reduce the violence that is enacted on them, as it reduce it to a kind of spectacle, right? That it's not just something for people to voyeuristically consume, but to sort of engage with in very deep and meaningful ways. I think this, for me, is deeply related to the question of whether or not names should be revealed. I mean, there's ways that I sort of feel on the fence about doing this, especially having not been in the archives myself, but hopefully being able to do so in the hopefully not too distant future, but sort of wrestling with what are the benefits to communities to have these names revealed versus what are the harms that might go along with the revelation of these names. And thinking about how we might make this information available for people searching for, family members, for example, but still have some protection in the ways that people can access who these girls are. And I think that's, I don't know if I have the exact, what that line should exactly be, but I think it's important for us to think about. I think a real model for, especially around issues of names and naming, for me has been what some community members, particularly Janice Hayes Williams, who's been really sort of spearheading efforts to commemorate those who have died at the Crownsville State Hospital and were subsequently buried there. Basically, she and a team of volunteers, some of whom were former staff and volunteers at the Crownsville State Hospital before its closure, have been embarking on this very extensive project of combing through death certificates, which become a matter of public record. So legally, there's a different kind of framework, but combing through those records to find the names of those who had been buried in the cemetery that still is on Crownsville's grounds, and having an annual ceremony in the cemetery in which those names are read out to sort of acknowledge and honor the fact that these people had lives and stories and families that are still looking for them and are still, grieving in many ways the many losses that come along with the kinds of institutional violence that go with an institution like Crownsville. I think also by extension, like taking this a bit further, from the perspective of the historian or the perspective of the archivist, or for those of us affiliated with these bigger institutions, is to think about, I guess, the ways that even as we try to wrestle with these histories within the institution, how do we square the circle? How do we sort of deal with the fact that even as we try to do this very important recovery and do this really important work, that we're still connected with institutions that continue to enact violence against communities that they inhabit, right? What does it mean for us to be wrestling with the impact of the Colored Orphans Asylum and people that are sort of incarcerated by this institution, alongside the fact that Johns Hopkins as an institution continues to enact violence against Black communities through gentrification, through the insistence on a private police force, through the ways that people, even those affiliated with the institution, receive disproportionate amounts of violence from it, right? And so I think that also has to come into the ways that we wrestle with this history, that it's not just about sort of recovering the names of people within institutions or affiliated with those institutions, but how do we use this history to make the institution a more ethical force in the communities and in the lives of people that are, you know, sort of surrounded by it and affiliated with it. Again, these are these big questions. I don't know that I have like exact, you know, sort of concrete answers to them, but I think we can't also do this history without reckoning with those other kinds of questions. And just quickly, I want to shamelessly plug an edited volume that is forthcoming with Johns Hopkins University Press called Do Less Harm, Ethics of the History of Health, Medicine, and the Human Sciences, being edited by Dr. Courtney Thompson at Mississippi State University and Dr. Kylie Smith at Emory University. And there, I will be contributing a chapter about archives in there, but there's lots of other sort of ethical dimensions that and ethical questions that we're wrestling with on this webinar that will hopefully be discussed in the forthcoming volume. So that is hopefully a resource that will be useful as we continue to embark on this history.
Thank you for that, and we will we'll be very glad to add that to our bibliography, and folks can always visit our website and find our growing bibliography of materials that have informed our thinking. So thank you so much for that. And but to your penultimate point, I think that you can appreciate, I hope, you know, how important it's been for us to be working in collaboration with Dr. Cooper, right? Who embodies, if I could put it that way, an institutional effort, an institutional commitment to think differently and to act differently for itself. And so we're doing this work not in any moment, but in a very particular moment where we not only are thinking as historians about the past, but we are part of an institutional active rethinking of itself, that kind of self-examination institutionally. And I think that helps me to think about where we are ethically in this particular moment, and perhaps not the same as, you know, moments very recent, right? But prior to the creation of Dr. Cooper's position and her arrival, it's, I think, a really meaningful context for what we're doing. So let me turn to you, Dr. Cooper, now that I've offered that, I think, really important appreciation for the role you play in shaping the ethical context for our work. And to reiterate that I think there's nothing, clearly that Chesney has gone through a deliberate review process with these materials. And so there are no concerns about HIPAA or other legal restrictions. And at the same time, you are yourself, I think, part of the same ethical reflection that we've and Kamal is especially mapped out for us today. So I wonder how this looks from your vantage point, if you will, behind the scenes. You've been a great advisor and more to us, but I know that you, for better or for worse, leave us to reach our own conclusions and to work with the materials the way they are. But is there an opening for you to work with researchers on the kind of ethical questions, and how does that look from the point of view of an archivist?
Well, I mean, I think that's something that's always open to sort of an individual conversation and discussion with researchers. The Colored Orphan Asylum records in particular don't contain what we consider medical records. And so they're in this sort of in-between place. In other cases, you know, part of that conversation is based on applying to the Privacy Board or for IRB approval in order to make sure that there's an understanding about the use that those records are going to be put, that there's a plan in place for protecting the identities of individuals who might be written about, et cetera. mean, for me, it was important to, with this collection, clarify whether or not these records were protected in some way, because I thought that this was a collection that would be of particular interest to the community, and that I wanted there to be as much access to as possible. And so I think, you know, there's information about some of the wards that's publicly accessible in other ways as well. And in some ways, it's up to the individual researcher to make a decision about the way that they want to engage with those identities in any writing and analysis that they do after that point. I think the names themselves are really important, partly because this is a collection that's really primarily documenting the white-run institution. There's very little there about the young women themselves. And as orphans who are already estranged in some way from their families of origin, those names are one of their only meaningful connections to that past. And I think it's important to be able to recognize their identities, their humanity, the fact that they were an essential part of this history, even if the records don't tell us everything we want to know about them. And a sort of first step toward that is recovering the names. So from my perspective, I think that's important work. And I think, you know, there's a difference between making a list of names available and making a decision to use those names in other kinds of writing. So on the surface level, I think the list is a way to make these accessible to potential family members and other genealogists, but also to help researchers, other researchers who are coming to this, understand that it is possible to piece together something about the residents. So those are sort of my thoughts about this particular collection.
Yeah, I think that's really helpful to my thinking twofold, right? That in a way our work is making or has the potential to make a kind of claim about what is possible, what we can know, right? And to challenge the assumption that as they have been often represented, right, the girls are regarded as the inmates, the orphans, as a not even a composite, right? Just as a simplified, undifferentiated collection of people, whereas the better studied, better remembered members of the boards of trustees, for example, stand out as individual characters with lives, with ideas, with their own histories. And so part of this work, I think, is probably an argument, right, with the view that you can't know about the girls, and that their lives, their individuality, their humanity is not knowable, is not retrievable, that it's lost to us somehow. I'm thinking very much through the lens of the work we do when we study enslaved people as well, right? This myth that we can't know about the particularity of enslaved people. And I've been talking with folks, who maintain collections that again are not constructed to tell the stories of the lives of enslaved people, but contain that material and new archivist approaches that index those names, right? Even when they are only first names, indexing those names as a way of saying to researchers, these people, these individuals, these lives, these facets of these materials are knowable to you. And I, as the archivist, am going to help you to see them through my practice of creating an index that includes those names. And that seems like a very important part of the story too. So I have enough time to turn to some of the questions that are coming in, and so let me do that. Let me acknowledge Dr. Leslie Schwalm who is here, because I know she is someone who's been very important for you, Dr. Cooper, and your doctoral work, a mentor to me. So she recommends Leslie Reagan's methods from her book Before Abortion Was Legal. And I see Dr. Nuriddin nodding, which used deathbed confessions involuntary extracted by legal authorities. And as I take it, Dr. Reagan used pseudonyms, but offered readers access to her data. They could contact her, and that's a really interesting new approach. So, and something we hadn't thought about. So, thank you so much for that. Here's a question from Youngin Jang, I hope I've pronounced that correctly, who's an ABD at Binghamton University and working on a dissertation about lower class children and childhood in antebellum Baltimore. This researcher wonders, is there any chance to see the orphan girl's voice or perspectives despite the silence? So I might use that as a question, Dr. Cooper, just to let you plug the Chesney and tell folks how they actually can come in and discover and use these materials for their own research.
Absolutely. So, I mean, the records are publicly accessible. The orphan asylum is actually opened in 1875. And I think there's some really important contextual work to do, thinking about the place that it has in Baltimore post-Civil War and other kinds of changes that are happening in the city at the time. So you're welcome to contact us at the Chesney via our main sort of reference email, or contact me, and we're happy to help you gain access. A lot of the records are financial records, but there are some administrative materials as well. And in the finding aid, I do talk a little bit about essentially where we can find traces of the girl's experience, despite the fact that the records are in some ways limited.
That's great. Thank you. I want to turn to a comment question from Adam Biggs, who thanks you all, says, loving this conversation, but asks, I think, a really interesting, poses an interesting juxtaposition. For historians, is there or should there be a difference between, on the one hand, writing about everyday disempowered Black folks? This might be domestic workers, low-wage workers, sex workers, incarcerated people, school children, on the one hand, and writing about patients through medical records. Is that really, does that divide or that distinction hold? I take the question to be, you know, aren't historians, in a sense, always or frequently, if not always, disturbing a kind of privacy that time allows for, even when the records are apparent? And maybe another version of the question is, what are the lessons from working with medical records that we should be bringing to records that we assume to be public and not private, and openly back to Kamal's newspapers and census records, right, that we assume are available to historians without reservation. I don't know who wants to jump in, but Dr. Nuriddin, please.
This is such a good question. I think it really troubles how we maybe historicize what is public and what is private. For me, I guess the how I kind of slice this in my own work is thinking about the ways that people like enter into the story in the first place. So when I'm looking at, for example, the records of psychiatric patients, how I sort of determine, well, because HIPAA tells me exactly what I'm supposed to do. So obviously I'm not breaking the law here, but I also wrestle with, like, this person is in a very vulnerable position when I'm looking at their records. They may be entering this institution against their will, or without, their will being consulted, right? And I think that kind of vulnerability, I think, needs to be treated a little bit differently than other kinds of aspects of the everyday. That the vulnerability of being a patient, I think, and this is applicable to some of the other categories of folks that we look at too. I think like the vulnerability of children has to be treated in a sort of particular way that's different than maybe how we write about other folks. The vulnerability of patients, the vulnerability of the incarcerated, right? Like that these are specific, and I think have to sort of be treated in particular ways. And there's not I don't know if there's like a blanket way to sort of broadly deal with all flavors of disempowerment, but I think as historians, we kind of have to wrestle with the particularities of the violence, of the racism, of the sort of vulnerability of the folks that we write about. And I think, it's, not maybe the best answer, but it's like, I think we have to actually deal with like the very specifics of who we're writing about, right? The who ends up in the Colored Orphans Asylum is a very different person that ends up in the Crownsville State Hospital, is a very different person than enters an institution of their own volition, as much as we can account for that, right? And how do we sort of, I think that's the thing we have to wrestle with, is what those particularities are and what the specific textures of that vulnerability is.
Thank you for that. I have just a minute left, and I wonder if I could turn to you, Kamal. We're going to see each other in just 30 minutes, and our lab is headed out for a field visit today to visit some of the historic sites connected to the Orphans Asylum. But maybe you could preview for us what you'll share with other folks in the lab today from the conversation.
Yes, so this conversation has been very, very helpful, and I thank you all for giving your input. But I guess the main things that I've learned today is that we really have perspective to take into consideration. And like Dr. Nuriddin mentioned, knowing who is vulnerable and how we can take their experiences into account to how we share them. And I think when like looking at the records of the girls, it's difficult to tell, were they forced there, were they by will there? Like, it's difficult to tell. Their specific stories will be narrated. So I think that is one of the big things I will take into consideration after this conversation is, well, who are we referring to, and how can we tell their story, if their story even should be told in the first place? So yeah.
It's terrific. I thank you all very much, and I know folks who are tuned in do too. I'm going to pass it back to Mallory Pilat, who's going to wrap us up. Thanks, Mallory, and thanks everybody for being here this afternoon.
Thank you. Thanks very much to all of our participants, Dr. Heather Cooper, Dr. Ayah Nuriddin, Kamal Kaur, and incredibly rich conversation. We're honored to have had you here and appreciate how much your research sheds light on the questions that we are asking at the Hard Histories at Hopkins Project. For me, this conversation truly highlighted uniqueness of medical archives in their content, in the way that we approach them, and in the way that I think they crystallize so much of the questions that historians ask about how our work affects the present. And this conversation also reinforces for me the importance of interdisciplinarity. I think historians need the input of scientists, and I also think that medicine really needs the lens of humanities. So this really, really helpful for thinking about that. And thanks to our audience for watching and for sending in your great questions, and to the team at the SNF Agora Institute for their support for this event. You can learn more about Hard Histories at Hopkins at hardhistory.jhu.edu. Additional information about our event series, as well as the YouTube videos of our past events, is posted at snfagora.jhu.edu/event. We have our final event of the semester on April 17th. Please look in the chat for the registration link. Don't miss it. Please also subscribe to our Substack at hardhistoriesjhu.substack.com, where we regularly post updates about what we're up to. Thank you so much, and have a great rest of your day.